Hi, I'm Coby. I'm an osteopath in the UK, and I'm going to talk to you a little bit about low back pain and see if we might be able to help you get a little bit of pain relief by doing some targeted exercises and stretches to your low back and to the tissues causing your pain. 90% of back pain is muscular. Only 10% requires medical attention. Now this is really great statistic and really great news, because that means there is absolutely masses that you can do to resolve your low back pain. The commonest cause of that 90% of low back pain is what we call a muscle imbalance. It's a lack of core. Your core muscles have gone to sleep and your movement muscles are overworking. They're having to compensate for the lack of action in the core stability muscles, and they just become, the movement muscles just become tight and they fatigue and they start to ache. So I'm just going to teach you some exercises today that will stretch out those movement muscles, take the two ends of the muscle away from each other and start to reduce the tension in those movement muscles, which will give you immediate pain relief. What it won't give you, however, is permanent resolution of your back pain, because you need to put yourself through a much longer rebalancing program where you kick in the core muscles, allowing the movement muscles to relax and then become strengthened, and your pain will resolve when all the muscles in your back are doing the jobs that they should. The stabilizers will stabilize, the movement muscles will move with enough strength in them to be able to do that job. I do have a rebalancing program available on my website. It's a 6-week program and it is very, very effective if you do it every day. That is the only if, the only clause. But for now, let's just get you started with a few exercises that you can do on a daily basis to give you immediate relief. But just please do be aware your pain will come back and it will continue to come back until you get those muscles rebalanced. So we're just going to start with a really simple exercise to stretch out the long chains of muscle either side of your spine, from the lumbar spine right up to the shoulder blades, in between the shoulder blades. And that muscle is called erector spinae. It's responsible for the majority of the pain you will be experiencing today in your low back. So just gently come forward if you can. If you do have a disc bulge that's moving backwards, you may not be able to do this exercise until your disc is back in position and you no longer have pain down the back of your leg. Everyone else, just gently walk forward. That's lovely. And bring your head to rest as close to the floor as you can. When you're comfortable, just start to walk your hands around to the left. And when you reach a nice comfortable end of range, just reach forward with that right hand a couple of inches and get a great stretch through the rib cage, stretching your lung, and naturally what we're aiming for is to get that erector spinae tractioned and stretched out. Breathe naturally, relaxing your body onto your thighs. And when you've had enough of that, just walk back to center, allowing your hands to take a lot of the weight of your body so that your back muscles aren't doing any work. Let your arms do the work and reach a nice end of range again over at the right, and then extend that left hand a couple more inches, reaching out from the shoulder there, opening up the rib cage. Lat dorsi gets a great stretch, a little bit into QL here as well, but mainly that erector spinae starts being moved. If you have had a disc injury and it's nicely back in position, this is very safe for you and is also very good as well. Coming back to center, remembering to take the weight of your body through your hands. Walk yourself back up into a sitting position, hands onto the knees, pushing yourself back up into a sitting position. This next exercise is going to continue to get a great rotational stretch through the low back. The more you can get movement back into the vertebrae and the joints, the better. So we're going to continue stretching out the erector spinae. We're also now going to get into the glutes and into the TFL, the tensor fasciae lata, and hopefully a little bit into piriformis if we're lucky. So let's start by lying down. Just come down, gently move onto your knees. Maybe have a little soft pillow, thin pillow, just to make sure that you're really, really comfortable. Okay, so let's start by having your left leg flat and your right leg bent if you can. Just raise the hips and take them to the right a couple of inches. Just take that right foot, place it on the floor on the opposite side of the left knee and take hold of that knee with the left hand. With the right hand, just unpeel it onto the floor at shoulder height, and we're going to turn your head to look at that right hand when we reach the extension of this exercise. Okay, lovely deep breath in, and as you relax, just very gently, don't push it at all, just draw that knee down towards the floor. And just gently observe where you feel a little bit of tension. You might feel it in your low back, you may feel it in the side of your hip, in the glute muscles, or you may feel it right down the side and even into your knee. Where you feel the tension is where your muscles are indeed tight and need the stretch. So each time you exhale, just gently encourage that knee down towards the floor. It's not the knee we're worried about, it's more the low back and the hip muscles that we're trying to release. Turn the head to the right to get an extra stretch. You're also getting a nice opening through the upper back here, through the pectoral muscles and the front of the chest. That will in turn help with your low back pain as well. So when you're ready to come out of this, contract your abdominal muscles. Use your abs to do this. Don't use your back. Use your abdominal muscles. Keep your back relaxed at all times. Back to center. Raise the hips. Bring them back to the middle. And release that right leg down onto the floor. I'm going to repeat that to the other side. So just bend that left knee. Raise the hips. Take them a couple of inches to the left. Take hold of that left knee with your right hand. And I've missed out the stage, which was to bring the knee across the other side, the foot across the other side of that right knee. Take hold and inhale. And as you exhale, just draw that knee down to the floor, releasing the left hand out to the side at shoulder height. That's lovely. So inhale, and as you exhale, gently encourage that knee down towards the floor. Remembering we're trying to release all of these muscles through here. On the exhalation, you relax, you don't push, never push a muscle, never force it, just gently work with it, work with its natural limits, its natural length it will lengthen and improve very, very fast if you work naturally and calmly with your muscles and don't force them through any pain barriers. Okay, so to come out of that, I'd like you to contract your abdominals again, raise that knee up. Bring the hips back to center and release your feet down to the floor. Shake out. This next exercise is another favorite of mine. It's really good for releasing through the front of the hips and the quadriceps, and also opening up through the side of the hips again, which is very important for releasing low back pain. You should get some movement into the joints of the lumbar vertebrae as well. So separate your feet about as wide. If you're on a mat, then try and have your feet on the edge of the exercise mat. So you've got quite a wide stance there. And all we're going to do is drop both your knees down to the same direction. So pick which direction you're going to go. And then on the exhalation, just drop the knees, relaxing the back, just drop the knees down. Bring the arms out to shoulder height. So you're opening up the chest, opening up the thoracics, starting to get a reversing of that thoracic curve. Turn the head to look left. So you should feel a lovely stretch down the front of that left leg, right down into the knee, and maybe a little bit up into the hip. And the main thing is we're starting to get some mobility back into this low back. That's great. Just rest there for a few breaths. And when you're ready, contract the abdominals, raise the knees back to center, and then repeat to the opposite direction, dropping both knees down to the left, turn the head to the right. When you're ready, contract your abs, relax your back. Don't want your back to bring your knees up. Your abs got to do all the work here. It's all part of the process of starting to kick in those core muscles. So contract the abs towards the spine, raise those knees up, and bring the arms back to center. Next, we're going to do some really simple knee hugs because they are absolutely brilliant at stretching out that lower back. They just get a great traction through the joints, opening up the facets, decompressing those discs and getting a nice stretch through the glutes and erector spinae again. Okay, so just start in a very controlled way. Again, relax your back. Just gently contract the abdominals, and if you can, just draw the knees up to a vertical position and then draw the knees towards your chest. That's lovely, just as close as you can. Relax your abdomen, relax your back, and relax your pelvis. If you want to increase the neural stretch, you can just draw the head up towards the knee, but you may find that's a little bit of a strain on your neck, in which case just leave the knees down, the head down. That's lovely. Sometimes it's nice to just do one knee at a time. Again, I'm going through these quite quickly, and if you do have low back pain, you will need to go through these quite gently and slowly at your own pace. Contract the abs, switch legs. That's lovely. Get a nice stretch through the glutes, through the low back and through the erector spinae. Okay, another one. Switch legs again. Just bring the knee diagonally towards the opposite shoulder. That's really good for getting into the glutes there, the glute medius, which is quite a difficult muscle to stretch there, and getting a little bit into piriformis here. Okay, and then just switch legs again. Bring the left knee up. Again, take that left knee towards that right shoulder. Diagonal stretch up, getting right in to that left hip and glutes. Just do it to a level that is comfortable for you and allow your muscles to naturally lengthen. That's great. Coming back to center. And just to finish off, I'd like you just to move your knees gently in a clockwise direction in a circle. This is going to just gently massage your sacrum and the base of your spine. It's going to release your sacroiliac joints and just start to get some gentle movement back there and the other way. Anti-clockwise direction, nice and slow, just allowing everything to know that it's safe to move. Often when you have prolonged low back pain, you stop moving everything and everything locks up, and unfortunately that contributes to your pain and exacerbates it and increases your pain. So even just by the nature of trusting me enough to do these gentle movements, your pain will start to release. When you're ready, just release the feet back to the floor. So there we are. That's just a few of my very favorite top exercises for getting instant, immediate relief to low back pain. One of the reasons you get the immediate relief is actually just by the nature of starting to move your back. When you have chronic low back pain, you do get into this cycle of pain. So you stop moving out of fear. That causes the muscles to tighten up even more, and that increases your pain, so you move even less. So all I'm trying to do here with this exercise, with this video, is start to break that cycle and just start encouraging you through not even a pain barrier, it's encouraging you through a fear barrier. The very best thing you can do for your low back pain, if you're in that 90% bracket of muscular pain, is move. But gentle movement that doesn't cause your muscles to react and spasm. So the great thing about all of the exercises I've done here is that they're on the floor and your body is completely relaxed and supported. So your back muscles don't actually have to do any work during these exercises. So these are completely safe for you to get you back on that road of moving your back. If you want to learn more about how to rebalance the muscles in your back in order to get a greater pain relief for a longer period of time and really take control over your low back pain, then visit my website soothclinic.com, where you will find a 6-week program that you can put yourself through with very, very good results. I wish you the very best of luck.